All right. Okay, here we go, gang. I will start over so you don't need to listen to that first half anymore. But Ray has volunteered to be our patient here, and I'm going to demonstrate not only how to do a 12 lead EKG, but I'm also going to demonstrate a 15 lead EKG, and then how to put on right side and posterior leads. Remember that all of those except the standard 12 lead are going to require a doctor's separate order to do, or you're going to get into trouble with the patient's medical record and overcharges, and somebody will come back and talk to you about it. I'll tell you more about the electrodes in another video, but I'll start by just showing you what a card of what we call resting tab electrodes look like. This is a card that contains 10 electrodes. Now it takes 10 electrodes to do a 12 lead EKG. So I put 10 cameras around to give me 12 different pictures of the heart. So this is what we're going to demonstrate on Ray, and then I'm going to show you how you can move these things around. Now in reality, we don't peel these up and move them to another location. We have to use a fresh sticker, because once you've used these once, they're pretty well done. They're kind of disposable at that point. One thing you will notice about these is that there is a little tab, a little metallic tab, which is not, doesn't contain the conductive gel. The tab itself has a silver chloride gel on it, which makes the electrical conduction. But there's a little tab here, which is going to adhere to our little alligator clips that we put on. Okay, so the first thing is that we need to find placement. Now we're going to, as soon as he lays down, we'll put him on the legs, the arms and the legs. So we're going to do chest placement while he's sitting up, so it's easier for you to see. So right here is his jugular notch. Okay, now this is where his sternum and his clavicle come together. So this is the sternoclavicular joint right here. This is his jugular notch. And this top half of his sternum is the manubrium of the sternum. And then where his sternum changes direction and kind of heads in a little bit is going to be his the body of his sternum. We've already talked about where these leads go. They go in the fourth interspace on either side of the sternum for V1 and V2. And those are really important landmarks to be able to put into place, because all the others depend on whether we get those two right. So remember, we talked about two ways to do this. One is to find the clavicle, and when we move off to the side, the first rib that we can actually feel is the second rib, because the first rib actually lies underneath the clavicle. And then we come to the second interspace, and then, or pardon me, the first interspace, and then the second rib. So right here is my second rib. I'm feeling it. Now the other way to find it is to find that sternal angle. So if I walk my fingers down his chest until I feel a bump in his sternum, and then on either side of that is where his second rib is going to be. And that's sometimes hard to feel, especially on people that have a lot of meat on them. You may not be able to feel that, so you may have to go by just moving off to the side of the sternum and marching down the clavicle. But in any case, here and here is my second interspace. I find that first to be able to go to my fourth interspace. So if this is the second rib, second interspace, third rib, third interspace, let me see, I lost my position here. Okay, rib 2, second interspace, third rib, third interspace, fourth rib, fourth interspace. So right there on either side of his sternum is where my first two V leads are going to go, V1 and V2. And I'm going to put my stickers on there. If he had a lot of hair there, I would have to shave that area. And once again, I can only shave the area where I'm going to put the electrode. I cannot shave his whole chest. And I'm going to put another one on the other side. So for a left-sided EKG, this is V1 and this is V2. Now I'm going to step over to this other side. The next one I'm going to put into place is going to be V4. I'm going to skip V3, which goes somewhere in here, but I'm going to go to V4. Once again, here's this clavicle. Okay? So find the midway point for his clavicle, which is right about here, and run down and find the fifth interspace, which is going to be the gap just below his left nipple. Okay, so that's where I'm going to put this fifth interspace. Pardon me, that's where I'm going to put V4. So it goes right there. Now, if you'll notice, I'm putting these tabs aiming down. The EKG lead wires are going to clip to these, and the cradle where all the wires come out of is going to sit right at his belt line. So I want all these aiming down. If I have them aiming up, the wires are going to pull them off, and they're not going to stay very long. The next one I'm going to put on is V6. Now V6 goes directly under the armpit in a mid-axillary line. This was a mid-clavicular line. This one's going to go in a mid-axillary line. And raise your arm way up. You can kind of see, maybe sort of, yeah, you can kind of see his ribs angle up. They don't go straight out like this. They angle up a bit. So I want to find that fifth interspace, and I want to follow it up until I'm directly under his armpit. And that's going to be where V6 goes. Now, I'll warn you, when you get in the hospital and you get with somebody, or you're in a clinic or something like that, and you get with somebody who does these a lot, they're not going to measure squat. They're just going to throw them on there and do it. I think that's a terrible way to do things. It can result in inaccuracies, but a lot of people just, they've never been taught the right way to do it, and they hand down what they learned to other people as well. Okay, so I have V1, V2, V4, and V6. So now we need to put V3 and V5 in place. V3 goes between V4, or V2 and V4. And V5 goes between V4 and V6. Now V5, remember, also has that landmark of if I put his arm straight down to his side, it'll be in an anterior axillary line. Okay? All right, so I got V1, V2, V3, V4, V5, and V6. V1 and V2 are in the fourth interspace on either side of the sternum. V3 and V4 and V5, or V3 and V4 are anterior. Remember that 4 goes in the midclavicular line at the fifth interspace. And then I have my lateral leads, which are V5 and V6. Okay? So I'm going to have him lay down, and we'll put the rest on. We've got 4 left. We've got 4 tabs left. We got 6 on the chest. We got 4 left. Those are going to go on his arms and legs. Now, hopefully you can, I think you can see, let me pan out just a little bit so you can see his feet, because I'm going to put these on his ankles. Now, I had already talked about that wherever you put them on the extremities, are you comfortable enough? Mm-hmm. Okay. Wherever you put these on the extremities, they have to be symmetrical. So if he has an amputated leg, and I end up having to put the electrode up here on his thigh, then the one on the opposite side needs to go on his thigh as well. I can't have one down here and one up here. That will screw up my electrical axis and give me all kinds of weird numbers. Okay? Now, for the chest electrodes, you remember I have all the tabs aiming down toward his belt. So for his feet, I'm going to have them aiming up toward his belt, and I'm going to put them on the inside of the ankle, just above that medial malleolus. And then for his arms, and another bit of etiquette, anytime I'm working on a patient, it is inappropriate for you to lean up against the patient. You need to go around to the other side if you need to do something on the other side of the table. And normally for an EKG, we would want him sitting up a little bit, but massage tables don't allow us that benefit. So for his wrist, the tab is aiming this way. Okay, and we'll put another one on the other wrist. Okay, now here's the order I would recommend that you do things. I would recommend that you measure, put the tabs on, then put the information in the machine, then hook up the wires and run your EKG. And the reason for that is if you put the information in the machine too soon, it could time out and you'd have to re-enter all that information before you get everything else hooked up. The other thing is that as soon as you hook up the wires, they're going to do their best to try and pull these electrodes off. So you're going to want to do that as the last little bit. Okay, so I'm going to move in here, go the right way. All right, so when I have, by the way, this is a brand new EKG machine, and so as with all machines, you have to learn their idiosyncrasies, and I haven't learned them all on this machine yet. So I have 10 wires on my EKG here. I have 4 really, really long ones. Let me get this here. I have 4 really long ones, and you can see that they're labeled left arm, left leg, right arm, right leg. So these are the ones that go on the extremities. And then I have 6 additional ones, which are my V leads, V1, V2, V3, V4, V5, V6. Okay. I have different kinds of clips on these, just to keep it straight. These white clips, in order to clip them on, and let me just get another card here. So when these are on, take one off here. So when, like, say this is on my patient, okay, then to insert this, I'm going to put that on and then push this down, and that locks it in place and grabs hold, okay? If I'm using one of these other kind, you don't have to raise the little clip or anything like that. Let me get this other one out of the way. You just simply take it and put it on there and it bites down, okay? Now, there's only electrical conduction on one side of this clip, so if I put it on upside down, it's not going to give me a reading. So I want to make sure that I put it on right side up to do that. Okay, so let's go ahead and hook him up. And another thing to think about before you go into a patient's room is that if all of these wires are all tangled up, which they tend to get that way, it's something that is built into them, you want to untangle them before you go into the patient's room, because it kind of disturbs their confidence a bit if you go into a room and you're cussing at your EKG wires. So this thing goes right about on his belt. And I have, remember, anytime we're talking about a patient, we're talking about the patient's right and left. So that is his left side. To me, it's his right, but it's his left side, and that's what's important. So the left leg is going to clip into here. The right arm is this one over here. And again, these wires are color-coded, white, black, red, and green. So when in doubt, go with that. I have a right leg which goes down here. And I have a left arm which goes here. Okay, so I have these hooked up. Let me pan out just a second so you can kind of see exactly what we've got going on. I always go the wrong way on this pan thing. So I have my, and we've already got one coming off, so these are just really, really sticky. I'm going to have to replace that one. And you have to watch that. Sometimes, if they've been out in the sun or something like that, the gel will stay on the card and not make it onto the electrode. So we'll replace that. Did you use any lotion or anything this morning?
Yes.
Okay, so we may have a little bit of issue with these staying on, because if the patient has used lotion, these things won't stick, and so we have to take some alcohol and clean that off. So it looks like that one, I don't know. We'll try it and see. But any kind of skin lotion or oils will need to be dried off the patient's chest before we can really do a really good EKG. So we use just alcohol wipes. I tell you, I always go the wrong direction.
Is the GoPro on?
Huh?
The GoPro, is it on?
I think so. I don't know. It's on my head. I can't see it. All right, so V1. I'll straighten out V2 a little bit here. V1, V2, V3, V4, V5, V6. So I have to put the right wires on. If I don't, I'm going to get some bad readings. Some machines are smart enough to pick up on that. Some are not. That's V1. Here's V2. V3. Now it gets a little more complicated as we move around to the side because these are going to want to come off. So if I put this on and it starts to peel off like that, I can just turn it to where it doesn't put so much strain on. 5, I need V4, it's V6. And missing a wire, here we are, V4. Okay, so all these are on. All of them appear to be at the moment sticking. So I'm going to go ahead and put my information in the machine. And as I told you before, you can do this. You can enter the information in the machine prior to. Trying to get a picture of the EKG machine here. So the machine is loading up right now, and I'm going to bring the camera down closer to the machine. And then the other thing I always do is lose my remotes. Alright, so to put information in this machine, now this is a non-interpretive machine. In other words, it's not going to tell me what his EKG is. It will give me certain parameters, but it's not going to tell me about whether he's having a heart attack or not. If I had wanted to spend a lot more money, I could have gotten the interpretive feature, and most machines will have that. If they do have that, then that means that you're going to have to add a lot more information in the machine. You're going to have to add the age, the weight, the sex, and the nationality of the patient, because each one of those parameters has a different algorithm that it accesses with certain cutoffs, which are normal for those populations and age groups and sexes and stuff like that. So you put in what the machine asks you. Don't skip over any of that unless you're running an emergent EKG. But if it's just a standard routine office EKG, then you certainly want to take the time to add in all that information because you're giving the machine a snapshot of the patient. So I'm going to go to New, touch Name, and I'm just going to this is Bill. So we're going to go Caps. It says name right there, so I'm going to hit Enter. And then ask for his sex. He's male. It's hard to do with gloves. By the way, with regards to gloves, in the handout I gave you, I said that gloves were kind of an optional thing. They're not anymore. Everybody wears gloves. There we go. And Ray, how old are you?
I'm 34.
Really?
Mm-hmm.
Jeez. I thought you were more like 20 something. Okay, so 34. Okay, so I've got all the information in this machine that it requires, so I can hit Start. And it's going to start examining the EKG. Got a lot of artifacts, so just relax your hands. When I see that much artifact, and somebody's come off altogether. Getting a little better, hang on. So I'm still getting a lot of noise from these limb electrodes, and that's probably because of the oil on his skin. I would probably need to take an alcohol wipe this down, but I'm just going to wait for this to plane out a little bit. And once I've got a reading that I like, which I really don't, I have a lot of noise in V2 or lead 2 and lead 3, and some in AVF. So I most likely, this little guy right here is just not going to stick for me. So I'm going to take an alcohol wipe. Clean that off. And then use another one. Seems to be doing better without it. Okay, that's starting to give me a better picture. I'm going to let that plane out again, smooth itself out. Now we're getting somewhere. Okay, when I've got a signal that I like, I'm going to hit print. He said. Whoop, we just lost V3. You'll notice this lead just popped off, and that's what that is right there. Okay, so again, we couldn't use this EKG. We'd wipe his skin off and replace that electrode, because that's his V3. Here's V1, V2, V3, and you can see that it's not even on his chest anymore. Okay, so again, we'd discard this tracing, we'd run it again. Now it says, just the information it got, his heart rate is 50, and it says that he's in a sinus bradycardia. That's to be expected. He's an athlete. He runs a lot. So I wouldn't get too weirded out about that. Okay, so that's how you run a standard 12-lead EKG. I'm going to shut this off. And I'm going to put that back on for a second. Now what I'm going to show you how to do is a 15-lead EKG. So I'm going to back out, put my camera back up here. And once again, he loses his remote. All right, so what a 15-lead EKG is that, well, that lead 2 just didn't want, or that lead 3 just didn't want to hang with us. I'm replacing this V3 because it's just not wanting to work with us here. Okay, so I've got my standard 12 leads already on. To do a 15 lead, I want a V4R and a V7 and 8, which go around the backside. Okay, so to do a V4R, I'm going to take one of these tabs and put it in the V4 spot, but on the right side. So here's midclavicular line. So V4R goes right about there. Now I'm going to take the V4 from over on the left and move it over on the right. Okay? Now here comes the fun part, because a lot of these are going to start popping off. So what I'm going to do is I'm going to take a towel and kind of put that over them to try and keep them in place. And I'm going to have Ray roll toward me onto his side. Now, this is why we do this. Most modern machines now will come with 15 lead wires, so you can do it all at one time. But for the older machines, you're going to have to put additional electrodes on and move some wires around. So what I'm going to do, kind of move this arm up there. Good, excellent. So here was, if you look, this was V6, and V8 is the one that goes right directly below the spine of his scapula there. Okay, the tip of his scapula is where V8 goes. So I'm going to put it right there. So it's in about the 5th interspace, almost across from V6. And then V7 is going to go in a posterior axillary line. So if I were to drop his arm straight down, that tab should just be barely visible. So we have 6, 7, and 8, and I could put a 9 in here between his scapula and his spine, but we're not going to do that for right now. Okay? Now what I'm going to do is I'm going to take the V5 wire here and put it on V7, and I'm going to take the V6 wire and put it on V8, and then I would run the EKG again. So I've got one on the right side, V4R, and then I've got V7 and 8 here. What I don't have anymore is V5 and V6 because I don't have V4, V5, and V6 because I'm using those wires for something else. V4 is now V4R, V5 and 6, V5 and 6 have become V7 and V8. So here's the other deal on that. Is that when I take the EKG, and again, this is not the one I'd be turning into the doctor, but so V4 is no longer V4. So what I would write on this one is V4R. I'd essentially edit my paper like this because V4 is now V4R, V5 is V7, and V6 is V8. And it's very, very important that I make note of that because the machine is going to interpret this as a regular left-sided EKG. And if I've moved some of those electrodes around, the machine is going to interpret as being a very bad thing. Okay? Now, if I were doing a fully posterior EKG, I would have done the regular 12-lead EKG, and then I would have V7, V8, and a V9 here. There is actually a V10 right directly on the spine. I don't know too many people that use it. And then my wires would shift over a little bit since I'm not using a V4R for a strictly posterior one. This would actually become V4. V4 wire would go to V7. V5 wire would go to V8. And the V6 wire would go to V9. Okay, so I'm just taking them off, and I can actually use any of them I want. I can use any wire on the body and move them around. The important thing is that if I've moved them from where the standard 12 lead is supposed to be, then I need to make a note of that on the patient's chart, or it's going to misinterpret the rhythm. Well, it's going to misinterpret the rhythm anyway. The question is, when the doctor sees it, is he going to be able to notice that? Because you've made notes on the chart. Okay, so that is a posterior EKG. I'm going to take these off of him because he probably doesn't want to wear them home. And these don't hurt when you pull them off. They're just like somebody chewed a bunch of gummy worms and left them on their dashboard in their car in the summertime. They're very sticky, but they typically don't hurt when you pull them off. Even off of hair, they don't really cause any issues. Okay, Ray, you can roll back. Is that just all kinds of fun? Mm-hmm. You'll be happy to know your EKG is normal other than that V3 wire that kept coming off.
Okay.
It said, I didn't see anything other than the fact you're in great shape. So to do a right-sided EKG, it's the same exact procedure as for a left-sided EKG, except that the electrodes go on the right. It's amazing. These electrodes don't stick to skin, but man, oh man, they'll stick to these gloves. Go ahead and take these off the extremities here. When I'm in lab sometimes and I get like 10 of these, sometimes people forget to take the electrodes off and I end up going home with them and I wake up and they're stuck to the side of my face in the morning. I don't know how that happens, but it does. Okay, now for doing a right-sided EKG, hang on a sec, let me move one camera here. Move this camera in a little bit, see if we can get a better picture. So this is going to be a little bit difficult to see, but again, it's not really brainy. I'm going to go ahead and I'm going to put my V1 and V2, but they're reversed now. Remember, in a left-sided, this was V1, this was V2. In a right-sided, this is V1 and this is V2. It's not just V1, it's V1R, and this is V2R. Okay? V1R, V2R, V3R, V4R, V5R, and V6R. So the only difference is I put these tabs on the other side. And again, for the sake of just moving along here, I won't precisely measure. And again, once you've done about 1,000 of these, you get pretty good idea on where they go. But you know, everybody has different chest contours and everything like that, so it still pays to measure as best you can. But keep in mind, Ray is not the kind of people that you're normally going to be doing EKGs on. They're going to be 300, 400 pound people, and it's going to be a little more difficult to find the landmarks. Okay, so I've got them on now. I'm going to skip the limit electrodes here. Come straight to the chest electrodes. Once again, I want to stress that if your patient is missing an extremity, if he's like missing this arm and I can't put the electrode on his wrist and I end up having to go up here and put it here, then that's where it needs to go over here as well. That's what determines your axis. And remember, the axis, we look at that and see, is it between 0 and 90 degrees? And if it's not, then we have a left or a right axis deviation. Alright, so I find my V1 wire. Now this was V1 if we were going left. This is V1 if we're going right. If we're coming this way, that's V1. This is V3, V2, this is V6, V4, somebody isn't here. That's not it. Ah. Here is V5. Now you'll notice that this is putting a little strain on my tab here, so I'm going to kind of unthread this a little bit. And really what I need to do is take these off and untangle my wires, but for now I'm going to cheat. Just undo them there. Okay, so now when I run this EKG, V1, V2, V3, V4, V5, V6, but we're not looking at the left side anymore. So this is V1R, V2R, as in right, V1R, V2R, V3R, V4R, V5R, V6R. The machine's going to read it as a normal left-sided EKG. So it's probably going to tell you that the patient's having a lateral MI, a lateral heart attack. So what you need to do is you need to scratch V1 through 6 out and put V1R, V2R, V3R, or you just need to write in big letters right-sided so that the doctor knows what he's looking at. Okay, so those are your standard EKGs. We did a 12, we did a 15, we did a posterior left, and we did a right. And there, of course, you can also do a posterior right. Just instead, it's V7, 8, and 9R. And now I'm going to show you how you would do this on a female patient. Especially if you are a male technician having to do it on a female patient. But nowadays, it doesn't matter. Anybody can be accused of anything. So you want to make sure that you maintain proper etiquette. And as I said, don't bump into the patient with your body on the table. Maintain some distance. By the way, when we were talking about the lab the other day, and they said, well, you can have a lab, but you have to maintain 6 feet of distance. I said, well, I really don't know how we're going to get those leads on it 6 feet apart. All right, so Ray, sit up for just a second. So I'm going to pretend like this is a hospital gown. So essentially, if a patient is wearing a bra, it's not always necessary to take off the bra. But if they're wearing one of these, kind of turn to the side there, so if they're wearing one of these with a big old strap, I call them old lady bras, but if they're wearing one with a real big strap here, you're not going to be able to get V1 and V2 in place, so they're going to have to take the bra off in that circumstance. If they got a bra with underwires to them, those underwires, if they hit those electrodes, can really screw up your signal. So you can either take the bra off, or you can stuff a towel between the wire and the electrodes to kind of help hold them in place. Okay, so that's a possibility. But for now, we're going to say he had to take his bra off. Darn, Ray. Just such a lovely one. And you can either put the gown on with the opening to the front, like this. So let me show you how we would do an EKG in that case. You can go ahead and lay back down. So he's got a gown on, and it opens into the front right here. Okay. Let me adjust my camera a bit here. Let me bring it a little closer. Nope, can't get it any closer than that. In any case, so I think you got a pretty good picture here. So he's got a gown on, and I'm not really exposing her breasts. This is Rayette now, and I'm not exposing her breasts. But just to make triple sure that she's comfortable with having me do this EKG, I'm going to take a towel and lay it across her breasts. Okay? So now her breasts are covered, but I've still got access up here to find V1 and V2. And then for the rest of them, I can move the gown up and put 4 through 6 on there. Now, if she's got real pendulous breasts, I've taken her bra off so they're not going to be contained. What I'm going to do is take the back of my hand and push up to move the breast out of the way. I never cop a feel. I always use the back of my hand to push the breast tissue up out of the way. If she's really big busted and you're going to need some help, have the patient lift their breast up. And then you put your electrodes right along the crease where the breast is, and then they can let go of it and it comes back down. Okay, that's one way to do it on a female patient. And I'll show you another way. Okay, sit up. Now if we put a gown on normally, it opens to the back. So it covers the front completely. All right, down. So imagine this is a gown. Okay, so I'm going to They're usually, yeah, you have to loosen them up around the neck here a little bit. Now again, I'm going to put the pad over the breasts, and then I'm going to take a sheet, cover the patient up, and then I just lift the sheet up to expose the area that I need right here, and then I can put V1 and V2 here, because I got exposure. Let me move the towel so you can see a little bit better. But I can get to V1 and V2 here, and then I can get for the rest of them up here without exposing the patient. Okay? So these are ways to safely do them on women patients without compromising their modesty at all. Now, if you tell them they have to take their bra off, then you need to leave the room. Tell them to take a bra off, put the gown on, have it open to the front or the back, whichever you want. But make sure you step out of the room while they do that. Okay. All right, so that really completes what I wanted to show you here. All the other stuff regarding the electrodes and all that, I can show you at another time. But review this video as often as you need to for a normal left-sided EKG, performing an EKG on a female patient, doing a 15 lead, and then a posterior and a right-sided EKG. And with that, we'll stop the recording. Okay. You are good to take